Cefaclor, Ceclor uses, dosage, side effects, and safety guide. Cefaclor is a second-generation cephalosporin antibiotic widely used to treat various bacterial infections. This medication effectively targets infections of the respiratory tract, urinary tract, skin, and ears, making it a versatile option in treating bacterial diseases. With its proven clinical efficacy and broad-spectrum activity, Cefaclor continues to be an important antibiotic in modern healthcare. What is Cefaclor? Cefaclor, sold under trade names like Ceclor and Ranaclor, is a second-generation cephalosporin antibiotic used to treat various bacterial infections. It belongs to the family of antibiotics known as cephalosporins, which are broad-spectrum antibiotics used for treating septicemia, pneumonia, meningitis, biliary tract infections, peritonitis, and urinary tract infections. As a cephalosporin-type antibiotic, Cefaclor works by inhibiting bacterial cell wall synthesis, stopping the growth of bacteria that cause infections. It's effective against many kinds of bacterial infections but doesn't work against viral infections such as the common cold, influenza, or coronavirus. What are the benefits and uses of Cefaclor? Cefaclor is highly effective against a wide range of bacterial pathogens, including some that are resistant to other antibiotics. Its continued use as a first-line treatment helps reduce pressure on newer antibiotics, thereby slowing the development of resistance. Conditions Cefaclor treats. Cefaclor is commonly prescribed for respiratory tract infections, including pneumonia and bronchitis, ear infections, otitis media, sinus infections, throat and tonsil infections, pharyngitis and tonsillitis, skin and soft tissue infections, urinary tract infections. Secondary uses of Cefaclor. Beyond its primary applications, Cefaclor can also be effective for acute bacterial exacerbations of chronic bronchitis, secondary bacterial infections of acute bronchitis, infections caused by Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis. How does Cefaclor work? Cefaclor works through a bactericidal mechanism, meaning it kills bacteria rather than merely inhibiting their growth. This makes it particularly effective in treating active bacterial infections. As with other cephalosporins, the bactericidal action of Cefaclor results from inhibition of bacterial cell wall synthesis. Specifically, it binds to one or more of the penicillin-binding proteins, PBPs, in the bacterial cell wall, which inhibits the final stage of bacterial cell wall synthesis and leads to cell death. Cefaclor has gram-positive activity similar to first-generation cephalosporins but adds activity against various gram-negative bacteria, including Proteus mirabilis, Haemophilus influenza, Escherichia coli, Klebsiella pneumoniae, and Moraxella catarrhalis. How long does Cefaclor take to work? Cefaclor typically begins working within a few hours of taking the first dose, though you may not notice improvement immediately. Most people begin to feel better during the first few days of treatment, with noticeable symptom improvement in 2 to 3 days. However, even if you feel better, it's important to complete the full prescribed course of antibiotics to ensure the infection is completely eliminated and to prevent the development of antibiotic-resistant bacteria. If your symptoms do not improve after a few days of treatment or if they worsen, contact your healthcare provider. How to use Cefaclor oral. Take this medicine by mouth usually every 8 or 12 hours, or as directed by your doctor. You may take this medicine with food if you have a stomach upset. Take this antibiotic at proper spaced intervals times for the best result. To help you remember, take this medicine at the same time daily. Continue to take this medicine until the prescribed amount is over, even if the symptoms disappear after a few days. Stopping this medicine too early may allow bacteria to continue to grow, which may lead to a relapse of the infection. Cefaclor dosage. Cefaclor is available in several formulations, including capsules, extended-release tablets, and oral suspension, liquid. The dosage varies depending on the type and severity of infection, age, and kidney function. Typical dosage instructions. For adults. Standard adult dosage, 250 mg every 8 hours. For more severe infections, 500 mg every 8 hours. Extended release tablets, 375 to 500 mg every 12 hours. For children. Standard pediatric dosage, 20 to 40 mg/kg/day divided into doses every 8 hours. Maximum daily dosage, 1 g/day. Safety and efficacy not established in children under 1 month of age. What should I do if I miss a dose? If you miss a dose, take it as soon as you remember. However, if it's almost time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Never take a double dose to make up for a missed one. What happens if an overdose? Symptoms of an overdose may include severe vomiting and seizures. If someone has taken more than prescribed or shows serious symptoms such as passing out or difficulty breathing, call a poison control center immediately. What are the side effects of Cefaclor? Like all medications, Cefaclor may cause side effects in some individuals. These can range from mild to serious. It's important to be aware of potential reactions and seek medical help if needed. Common side effects. These side effects are usually mild and may go away as your body adjusts to the medication. Stomach upset, nausea or vomiting, diarrhea, headache, stomach pain, vaginal itching or discharge, white patches in the mouth, oral thrush. Serious side effects, rare. Though rare, serious side effects may occur. Contact a healthcare provider immediately if you notice any of the following: persistent nausea or vomiting, yellowing of the skin or eyes, jaundice, dark urine, unusual tiredness, easy bruising or bleeding, mood changes or confusion, changes in the amount of urine, signs of a new infection, fever, sore throat, unusual joint pain, severe allergic or intestinal reactions. In rare cases, Cefaclor can cause severe hypersensitivity or intestinal conditions. Rash, itching, or swelling, especially of the face, tongue, or throat. Trouble breathing. Clostridium difficile-associated diarrhea, with blood or mucus in stool. If any side effects persist, worsen, or seem unusual, consult your doctor promptly. Never ignore symptoms, especially if they appear suddenly or severely. Precautions and warnings. Before starting Cefaclor tablets, it's important to take a few safety precautions to avoid unwanted side effects or complications. Who should avoid this medicine? Cefaclor should not be used by people who have had an allergic reaction to Cefaclor or other cephalosporin antibiotics, have had a severe allergic reaction to penicillin antibiotics, as cross-sensitivity may exist, have a history of cephalosporin allergy. Conditions where caution is needed. Use Cefaclor with caution if you have kidney disease or impaired kidney function, history of gastrointestinal disease, particularly colitis, history of allergies, especially to medications. Are there any age restrictions for using Cefaclor? Cefaclor's safety and effectiveness in children younger than 1 month of age have not been established. Extended-release tablets are not recommended for children under 16 years of age. In elderly patients, kidney function may decline with age, and since Cefaclor is eliminated through the kidneys, older adults may be more sensitive to its effects. Alcohol or food interactions. Alcohol consumption while taking Cefaclor is not specifically contraindicated, but it may increase the risk of certain side effects or mask symptoms of an adverse reaction. It's always best to consult with your healthcare provider about alcohol use while taking any medication. Food does not significantly affect the absorption of Cefaclor, so it can be taken with or without food. However, taking it with food may help reduce stomach upset. Possible interactions with other medications. Cefaclor can interact with other medications, which may alter how it works or increase the risk of serious side effects. Some notable drug interactions include: probenecid may increase blood levels of Cefaclor. Live bacterial vaccines, such as typhoid vaccine, may have reduced effectiveness. Oral contraceptives may have decreased effectiveness. Anticoagulants like warfarin may have increased effects. Some immune checkpoint inhibitors may have reduced therapeutic effects. Cefaclor may also affect certain laboratory test results, such as causing false positive results in some diabetic urine tests. Always inform your healthcare provider about all medications, supplements, and herbal products you are taking before starting Cefaclor. How should Cefaclor be stored? Proper storage of Cefaclor is essential to maintain its effectiveness and safety. Recommended storage temperature for Cefaclor. Storage recommendations vary by formulation. Capsules and tablets, store at room temperature, 68 degrees Fahrenheit to 77 degrees Fahrenheit or 20 degrees Celsius to 25 degrees Celsius, away from excess heat, moisture, and light. Oral suspension, after reconstitution, store in the refrigerator between 36 degrees Fahrenheit and 46 degrees Fahrenheit, 2 degrees Celsius and 8 degrees Celsius, with the lid tightly closed. Discard any unused oral suspension after 14 days. What happens if Cefaclor is not stored properly? Improper storage can lead to decreased effectiveness of the medication, potential development of harmful breakdown products, changes in appearance or consistency, especially in the oral suspension. Keep all medications, including Cefaclor, out of reach of children and pets. Extended release tablets should be swallowed whole and not chewed, cut, or crushed. How long does Cefaclor take to work? Cefaclor typically begins working within a few hours of taking the first dose, though you may not notice improvement immediately. Most people begin to feel better during the first few days of treatment, with noticeable symptom improvement in 2 to 3 days. However, even if you feel better, it's important to complete the full prescribed course of antibiotics to ensure the infection is completely eliminated and to prevent the development of antibiotic-resistant bacteria. If your symptoms do not improve after a few days of treatment or if they worsen, contact your healthcare provider.